Hello and welcome to this virtual roundtable from Foodservice Consultant Society International FCSI. Today we are addressing innovation in healthcare food service. My name is Michael Jones from Progressive Content and Editorial Director of FCSI's Foodservice Consultant magazine. This roundtable is kindly supported by Welbilt and will address how evolved thinking, processes and technology are helping hospital and senior care living food service operators to improve flow and create efficiencies in kitchens and serving areas, as well as exploring how innovation is being harnessed to make safer, more hygienic food service environments in the healthcare sector in response to the COVID-19 pandemic. I'm delighted to be joined today by two top design consultants in this sector, the System Director of one of the US's leading providers of healthcare, and the Chief Innovation Officer of one of the food service sector's largest, most diverse equipment manufacturers. I'll now ask each of them in turn to introduce themselves and just give us a quick overview of their organizations. Dave, can we start with you first, please?
Sure. My name is David Reeves, and I'm the System Director here at Lee Health in Fort Myers, Florida. And we are a 5-hospital system. We have 4 acute care facilities, and then we have a children's hospital, along with many of the different surgery centers and cancer centers here in the Lee County area in Fort Myers, Florida area.
Fantastic. Thank you, Dave. And Christine.
My name is Christine Guyott, and I am a healthcare principal at Rippe Associates. Rippe Associates is a food service design firm located in Minneapolis, Minnesota. We just reached our 40-year company anniversary this month, so we're very proud of that. We do work all across the country, not only in healthcare, but in other segments as well. We have approximately 30 people that work out of our Minneapolis office.
Fantastic. Thank you, Christine. And Ray, please.
Hi, good morning, Michael. Thanks for having me. Nice to be on this panel with such great colleagues. And I'm with Webb Foodservice Design in Anaheim. My home office is in Portland, Oregon, and I've been in food service for a little over 35 years and proud member of FCSI for over 20 years this past year. I enjoy creating a synergy between operational flow and delivery systems, and with an emphasis on sustainable design. And I really enjoy working with those who believe we have an obligation to offer a path to net zero solutions when they're justifiable and affordable.
Excellent. Thank you, Ray. And Rick, finally, please.
Thanks and good day to everyone. So again, Rick Caron, Chief Innovation Officer, Welbilt. My job is thinking about the future of all of our products across the categories globally. You know, I love food, I love people, I love equipment, technology, and where they all come together is really in the kitchen. Our industry is consolidating, so the exciting news last week of Middleby acquiring Welbilt has really sent people into a tailspin. It's all good in that it gives us just more access to brands, technology, and I'm looking forward to this discussion because part of what I do is, listen big time to our customers, the consulting community, and then really stimulate the brains of our customers around what the future innovations are, because we've got to think ahead 3, 4, 5 years on our products. Some of the big platforms like digital platforms take that long to get into the market. So I'm looking forward to the content here today and getting deeper into the discussion.
Absolutely. Many thanks, Rick. Dave, let's come back to you if we can, please. Can you give our viewers an overview from your perspective at Lee Health as to how your organization's food service operations have been directly impacted by the pandemic? What have been the biggest challenges you faced, and how have your team helped to overcome those?
Sure. So one of the things I would like to mention is prior to working at Lee Health, I'm actually relatively new to Lee Health, so I've been here for just over 6 months. So prior to this, I was working at St. Jude Children's Research Hospital in Memphis, Tennessee, and that's where I worked when really the crisis phase of the pandemic started. And so I would share a little bit of both, and as well as a little bit of the input that I've had from my peers in the industry. So I would look at it really what I would consider to be the crisis phase. And that's when the pandemic first came out. We didn't know a lot about it. We were looking at what's going to happen. So, there were so many different unknowns for us, and we were lacking in personal protective equipment, just the sanitation aspects of what do we do with sanitation? How do we sanitize? immediately some of the things that we did as self-service stations, those all ceased. And just general concerns with employees being able to come into work. I'll tell you, one of the things that we had concerns about, we had about 80% of the campus that ended up working from home, and that immediately hit our retail volumes. So, one of the things in healthcare food service, we rely on those retail volumes to help fund operations. But the other thing, we were able to utilize about 50% of our labor. So what we did is we used half of our labor staying at home so that we did not mix the labor, because we were concerned if somebody got ill that they could basically knock out the whole kitchen. We have also at St. Jude needed to set up a remote feeding operation. We have two different phases. So we had were patient families and caregivers of the patient location, and then the support areas would dine in another location, so we didn't have them crossing paths. But as we started to get used to the pandemic, one of the things that we found is that we started to become, I would say, a little bit more normal with operations, and some of the facilities, definitely, I think the larger healthcare systems, one of the things that they struggled with was they had to stop all of their basically essential procedures. So healthcare operations took a huge hit financially. So that's where we started to figure out, how are we going to respond to this from a financial perspective? But ultimately now we've found that the food service industry has become so resilient. We've come back, and at the point where the college and university market, or the K through 12 market, or the restaurant industry was really struggling and not even open, healthcare was one industry that was actually maintaining their food service operations. One of the other things that I know that we did is, a lot of us, we set up areas for people to feed staff. So we actually set up little C-stores. So people, when they were having problems with getting their groceries, they were able to come into our operations and come into work, get groceries to take them home with them. So, a lot of creativity helping to bring the operations back. Now we're pretty much back at full volume. I think our retail volumes are still suffering for most part, but some, we here at Lee Health, we still need to get those retail volumes back. But I foresee in the very near future that we'll be back to business as usual. So, it's been a whirlwind. I've said that it's something that I never expected to have in my career. Probably none of us thought we'd have this, but that's the thing, that we've been so resilient with this, and it's been fantastic for us to see how we've responded.
Fantastic. That's a great overview. Thank you very much, Dave. Christine, back to you. Dave's reference there to kind of the whirlwind of the experience that you guys have kind of all had to manage in the last year, but also a phrase there from him, things are now a little bit more normal with operations. Do you concur? Is that the kind of experience that you're having now with your clients in healthcare food service? And also, what sort of creative solutions and what sort of innovation have you seen that's been able to help overcome some of those challenges this past year?
Yeah, Mike, I think the crisis is certainly a time that we didn't hear from our healthcare operators as much. There were some calls about how can I get some equipment very quickly to set up these different stations that we would get. But our design projects, maybe took about a month of a little bit of a lull there in April last year, but then they just started rolling on again. And I think the questions, that we get now is, what will it look like post-pandemic? And how do we plan for that? Because do we continue to plan for social distancing? Do we continue to plan for, no self-serve? And, clients are really looking to us for an answer. And I don't think there's a crystal ball out there to know, but we have heard that this is not going to be the only pandemic that we have. So the volume is a big question because, Ray and I design our facilities based on the volume of people that are coming through. And when there were no visitors in healthcare at all, and we had, as Dave mentioned, many people working from home, will that continue? I have heard many healthcare facilities saying that the folks that could work from home don't need to be on campus anymore. So there's going to be less volume there. Does it go to, not as many visitors in the future, so we don't feed as many people in the cafeterias? So, volume is a big question moving forward, and architects and facilities are not going to give us any more space just because we have a pandemic. So it continues to, challenge us to do flexible spaces.
Thanks, Christine. Ray, moving on to you. Dave mentioned there the need for some creative solutions during this whole process, and also Christine mentioned some clients having a fairly urgent need for some new equipment and the need for more flexible spaces. What kinds of technology and/or equipment have you seen having a major impact on healthcare food service this past year? What's really sort of surprised you or impressed you in terms of its application as well?
With healthcare, first of all, I'd like to say I've been very impressed on how quickly manufacturing communities have pivoted to awesome solutions that weren't in their R&D plan to start with. And I think the types of equipment that are available may or may not be affordable for David's group to implement because they've taken such a big hit. So as consultants, we've been sensitive to the fact that we have to figure out sensitive ways to help them first get back on their feet and start regenerating some of the volume and revenue that they've lost to be able to hold on to their labor pool. And but some of the impressive things that I've seen come out of the manufacturing side and the technology side has actually been more catered towards front of the house rather than back of the house.
Right.
Things such as there's been a major improvement in UV indoor air purification systems, which were crucial and critical, whether it was a HEPA filter system to start with. Now we're being able to offer the architects a solution to consider with their engineering teams. They can put in a UV light box in a suspended ceiling and have the air go through that and actually kill the COVID virus. Now, COVID may not be around in a year or two, but there's going to be, something else. So that, there was SARS, there was Legionnaire's disease. So we can't design towards or recommend equipment just for one thing, but antimicrobial LED technology starting to find a footprint, and some of the breath guards that are being offered now have antimicrobial aspects to it. There are manufacturers that are starting to tinker with UV lights even in a hot holding cabinet. I saw one of the manufacturers come out very early on. So I'd say those are the types of innovations that I've seen come out in the forefront of the pandemic. And then as we move beyond it, we'll start implementing some back of the house solutions, whether it be just basic warewashing and hand washing and sanitizing or other types of equipment.
Brilliant. It's a really good summation. Thank you very much, Ray. Moving on to you, Rick. Ray mentioned there he was very impressed with the pivot and the kind of speed of change there. From the manufacturer's perspective then, how has the pandemic been a sort of catalyst for ramping up R&D in innovation in the healthcare segment specifically, and how has that rate of change been affected? How have you guys kept up essentially with this need?
Yeah, well, basically what it did was create an incredible sense of urgency to respond. Because, last March, it was kind of a big surprise. All of a sudden, we're in lockdowns. We got facilities around the world. And even today, whereas a lot of the markets in the U.S. are coming to some level of normalcy, India is not. I mean, India is at an all-time high. China recovered. Hotel X, the big trade show was a few weeks ago. It was full. So it's kind of interesting that as a global company, we're seeing these peaks and valleys, all over the place. But for our company here at headquarters in Newport Richey, Florida, we were fortunate to keep it open because we do a lot of development work here, testing, culinary. We immediately went virtual on the demonstration. So we'd have customers with equipment on one at their location, and we'd send the information digitally, the cooking programs to that location, cook here, and compare the quality aspects on the food, just through this type of virtual meeting. 20 design centers around the globe. And they immediately started working this way. And in a way, the productivity went up because we didn't have to travel. I was traveling all the time. Then I stopped traveling. right? And so the focus was around the pivot. And the first level of it is, what can we do with the equipment we have today? Or those things that were in development that never came to market for whatever reason, to get those in the market. So you've already mentioned a lot of them today. You know, UVC, we've got it here. HEPA filters are fantastic. And the next level is those that go through thermal decontamination. So we're launching, you know, something called Aerotherm, and with the right air exchanges in indoor spaces, you can safely reopen, because the HEPA filter removes, you know, 99.999% of the particulate, including COVID, but then it goes through a thermal decontamination cycle to kill it every single night. It's IoT. You can track this over time. So what I'm really saying is the products became born digital, right? So most of them are connected now. You can track them, but they're also born safe. And Ozone is another one of my favorites. Ozone is an O3 molecule that you can create very simply. It has very high sanitation rates. And then when it evaporates, it just turns back to oxygen. So it's fantastic for make tables, for sanitization. You know, we basically kept our centers open, working. I think originally, you know, David talked about resiliency, but I think what hit us at the beginning was a surprise. The industry wasn't that resilient when that 30% dip occurred and, you know, 100,000 restaurants, but the pivot now has shown that it is really resilient and will become more resilient through innovation. And so that's kind of what we're doing, and we have to connect the dots between these technologies and the application. And the key, someone mentioned, I think it was Ray, you had talked about payback or, you know, economics. At the end of the day, it all has to work financially.
Yeah.
So, you know, you're right. There's not going to be more space. So flexibility, I'll call it space utilization, delivery, central production, tiny kitchens, big kitchens. How all these things come together needs to have unit level economics that work for our customers. So those are some of the things. It's incredibly exciting. I think everybody's brain is on steroids out of this. And my own opinion is the shadow of the pandemic is going to be pretty long. It's going to be years. I don't think things are going to get back to, you know, what we think of normal until 24, 25. And I think some of the things that we learned are going to stay in place for the rest of the decade.
Thank you, Rick. Dave, looking at some of the things that may or may not stay in place, looking at this kind of self-serve aspect that Christine had already referenced, but kind of front of house serving areas, looking at things like salad bars or buffets in kind of hospital food service, those options being replaced by pre-portioned food, grab-and-go alternatives. Do you think that status quo will exist long after the vaccine program has done its job? Do you think old ways will return? When do you see those kind of front-of-house areas changing back, if at all?
Sure. So, you know, it's an interesting perspective a year makes. 9 to 12 months ago, I'm probably on record of saying that salad bars are gone, will never come back. I've changed my tune. And I think they will be back. I think, you know, we tried various options at the salad bars, going from, you know, serving and making salads to order based upon customers' preferences, to setting up grab-and-go areas, to the fact our customers want to make their own salads. And so I'm on record now saying I think it will come back. Will it come back in healthcare immediately? Some of our operators are bringing them back. I think, you know, probably won't be for another 12 to 18 months in my perspective, but we'll see. We'll see where that goes. So I think, you know, even, you know, you start looking at some of the things that I thought would have been something that everybody would have been shifting to at some point, going to many of the contactless beverage dispensers and things like that. We purchased some, and you know, at St. Jude Children's Research Hospital, and had them installed. But, you know, I'm not seeing those out in the market, maybe, but, you know, it's got to make financial sense for organizations, you know. So we'll see. But, you know, our customers are pretty stuck in the way that they want to have their food. And I think once the vaccine program and people start to settle down, I think things will come back. Much different, though, than I would have thought 9 to 12 months ago.
Thanks, Dave. Christine, do you agree with that? Do you concur with that view?
I do. I think there were folks that were trying to get rid of the salad bar, years ago, and there were some designs that we took them out of, and the nurses love them, and when you take it away and they want it back, it comes back. So I think it's customer demand, and we'll see what the customers demand after this. If they have a stomach for it, I think. People have done some innovative ways to self-serve with, different utensils or sanitizing to make that still happen. I think the design flexibility of protector shelves, breath guards, being able to pivot from service to self-service, as long as you had room behind them. So I think we're very aware going forward of, can you get behind each station?
Right.
Can you have somebody that could stand there and serve? Our customers' issue, though, is they don't often have the labor to have everybody stand behind a counter and serve. So I think it has to be flexible in both ways. I don't think labor is going to get any easier as we go forward. So it'll be a constant struggle between, served and the amount of labor that's available to serve. So I think it'll come back because of necessity. And I think everybody's going to be different in how quickly it comes back. It might come back quicker in Florida and not so quickly in Oregon. So we'll see what the customer stomach is for it, and I think that'll dictate whether and when it comes back in each facility in each part of the nation.
Great answer. Thank you, Christine. Let's go to Oregon and ask Ray. Looking at senior care living facilities that you work with and your clients there, what do you think the long-term future is for those kind of food service facilities, and what will that be shaped by? What are the biggest factors in play for that part of the sector?
I have a slightly different perspective when it comes to the salad bar situation. So I'd like to circle back on that for a second and then maybe answer your question, because what we've noticed was, even pre-pandemic, salad bars were going away for other reasons, and they were mostly due to labor and being able to, and food costs, and being able to maintain them for those reasons. So I thought that operators were shying away from salad bars because of those reasons, and I don't see them coming back as quickly in senior living market segments as you might see them in a B&I market segment.
Right.
And I see that senior living is a delicate balance between community and privacy, which is also true in healthcare, but it's a different level. What we've seen is, with the COVID isolations, meal delivery to rooms became the normal, and that necessity is now going to be converted to a luxury service meal delivery option for either independent living or assisted living. And the large dining rooms are still attractive, but I think it's going to shift as the boomers start filling the communities. There'll continue to be a demand for dining room atmosphere and co-mingle, but the demand will be more for casual dining rather than a formal dining, and that'll continue to rise. And then the food service worker is going to redefine how they interact in the workplace, because that interaction, now with all the COVID training, we've finally been able to have all that HACCP training be implemented on a daily basis, where people don't have to think about it as much anymore, because we're all hand washing. So those are the changes that I'm seeing in senior care.
Great stuff. Thank you, Ray. Dave, from your perspective, I just want to focus on the whole concept of wellness and kind of well-being. How is the design or layout of a hospital, say retail operation, a contributing factor towards something like wellness? How are you and your team working to ensure that healthcare facilities, operations continue to be places where patients and their families can recuperate, can bond, can relax in a kind of post-pandemic environment?
Sure. I think, there's a couple elements of that. One is that much of the group that we feed are not only the patients and the families, but it's also the employees and physicians and those of the organizations. So, I look at it from a couple perspectives. This is an opportunity if somebody's in for a test or they're in there visiting a loved one. It's one opportunity that they can get away from, the area that they're at. And maybe what we want to do is we want to get them into an area that looks inviting, that doesn't feel like a hospital. So we're looking at, how can we incorporate designs that are more retail-like, so like you're not even in a hospital. I've done a couple designs recently, and I'll tell you that the one that I did for a replacement hospital, Christine and I worked on that, and one of the things that we went from, we said, we're designing a food service operation that just happens to be surrounded by a hospital. That's the goal that we had. We went into designing this, and so we were looking at spaces that were not large dining rooms. We had a dining room of 272 feet, but we separated it out into areas so that it felt more intimate and inviting. And I think one of the things that I found that is really interesting from the operator perspective, we work to get the design of the functionality of the kitchen. We work to get the design and the functionality and the movement of the retail operations. But then it gets handed usually over to the architect. We work so hard at that. And then the interior aspect of it is something that we don't have a lot of input on. So in one of the more recent designs that Christine and I worked on at St. Jude Children's Research Hospital, is we were really proactive, working with the architects, helping them understand what a retail environment should be like, and help design that because, again, that's where we talk about the folks, they're going to get in and they want to be away from that. And then the whole employee aspect of it, it's a big employee satisfier for the staff. So those are some of the things we've looked at.
That's fantastic. Thank you very much, Dave. Rick, what kind of innovative thinking, technology processes, particularly in reference to what Dave was just saying about bringing in that kind of retail thinking into something like a healthcare sector, what kind of innovation has made the biggest positive change on the healthcare sector in your view in the last couple of years, and why?
Well, it's a big question. I mean, on the retail side, bringing the brand expression, brand promise that consumers love into healthcare involves a lot of different things because it can involve the technology around the equipment, the touch screens. We've got some equipment that's actually changing the menu and the brand every few days to stay in touch with what the customers want. In terms of the innovative thinking, I would say it's just lateral thinking. It's taking all the things like we've discussed today and connecting the dots in terms of what they mean in terms of technology and process. And the technology is not coming from just one place. So that means we need to have an open innovation strategy and connect into where those technologies are. So yeah, UVC light, great contribution. But I think the biggest thing for me is an understanding of how COVID spreads. And really, everybody was thinking about touching and sanitizing surfaces, and it's more through aerosol. We're all emanating here as we speak, the primary cause, and those can be controlled. And ironically, in healthcare, that's always been known in hospitals. That's why masks are worn. But the nature of the control can be built in, portable systems, central systems. The technologies are many. I mean, I could talk for hours on them. I think the key is connecting the dots into the technology, applying them, working with early adopters, and finding that ROI, finding that payback. In terms of the process, they should be bolted on. So we're not going to invent all new fryers and ovens and grills overnight, but how do we actually extend the life of the growth period of these products by bolting on these technologies? And the biggest one is connectivity, right? Because we talked about the kitchen as an operating system, and if you're not measuring, you can't control. So to measure, you need to have some form of sensor and some sort of measurement system. And so I see that all of this is moving to smart cloud systems where the kitchens are actually controlled better end to end through connectivity. And I think there'll be ratings, just like there's sustainability ratings now on some of our equipment. I think there'll be ratings on how resilient equipment and kitchen operating systems are in terms of infection disease control, in terms of flexibility, in terms of footprint. So those are some of the things. There's not a short answer. Right? There's a lot of technologies. It's connecting the dots between the technology and the end use application. And the process is really around open innovation and attaching those innovations to the standard products that are out there, but making sure that they're connected. Because if they're not connected, it's going to be very difficult to keep them up to date over their life.
That's great stuff. Thank you, Rick. Christine, in your experience, I mean, clearly Dave and his organization are very forward thinking about this, that kind of open innovation that Rick was just talking about. But generally, are healthcare clients that you work with, do they have an appetite to embrace new technology, new innovation? Is it more or less so than maybe other sectors you and your colleagues work in?
I think they do. I think they're very forward thinking as an industry anyways, with their tech. So I think that they are looking for different opportunities. I think sometimes it's harder for them. There's more layers of administration to go through than other industries. If you have a restaurant and you're a self-owned restaurant, it's easy to make a change very quickly. One of the changes we're seeing in technology, and we're putting into all of the new places, is pre-order stations where people are pre-ordering and picking up in different areas. Now, there's a lot of folks that had started that pre-pandemic. I think it went a little quicker, during the pandemic, and there's not a design we have right now that we don't have that in consideration. So I think there's a lot of folks that want that in healthcare, but there are some challenges to IT and privacy and how they can implement that. Not to mention some of the finances right now are not best to include those. But really see that technology taking off, and I think what we have seen and would like to see more of is the pickup stations. Where do they pick up? And I'm not necessarily think it always has to be a locker or a heated or cold locker, but how can we have some of that easy pickup like we do at some of the national brands, Panera and Starbucks and all those? How do we build in those cubbies, and can those cubbies be heated or cooled, or how can we introduce some more technology to those pickup stations? So I think healthcare by and large will bite off that technology if they can. They just have more hoops to go through than I think other industries. Right.
Thank you, Christine. Ray, as a consultant with a lot of experience in senior living care at your consultancy, are operators you work with closely largely aware of the new technology available to them currently, and are they responding positively to them, as Christine was just describing?
I found that the more sophisticated self-operative or contract operation firms are. They have the need for the return on investment with the use of the technologies. And we, as a consultancy firm, try to guide them through whether or not it's worth investing in technology A versus technology B. I mean, we all remember how the CD was going to be the last form of storage, and now we don't even have, we backed up all of our data on CDs at one point in our lives, and now we don't even have laptops with CD receptacles anymore. So, we don't necessarily want to entice a client to invest too much in technology until it's been proven across the board, as Richard's saying. We want to have an integrated system so that they can rely on these buildings that we're building for 30 or 40 years.
Brilliant. Thank you, Ray. Dave, what is Lee Health's strategy with regards to implementing new kitchen equipment, and when do you do it? And also, what are the biggest factors that influence that kind of decision-making in terms of regulation, budget, timing, long-term planning? What's behind that?
Sure. I think there's a couple things. One is that we're always looking at end of life, of course, and looking at things that are new service models. So, one of the things that, we'll be looking at here is changing over to new service model that's going to actually require some fairly significant capital investments. And, in healthcare, it's one of the things just, getting capital dollars for the support service areas is always incredibly challenging. I've been in those meetings where you hear that the OR is in need of new supplies and things, or the areas that really need new technology. And even myself as a food operator wanting to get the funds from my department and knowing that it's essential, I have a hard time even going up against some of those revenue generating areas. So it's always competitive. there's always more, more money requested than it's available. And so, it's important for us as operators to really have a 5-year capital replacement plan that is well socialized in the organization, and that talks about equipment that is, nearing its end of use, or just maybe it's something that we are spending more money on repairing that than it takes to buy a new piece of equipment. So I know me here at Lee Health, one of the things I'm really looking at is making sure that I standardize the equipment, that I don't have different brands of equipment throughout each facility, because that's really important to me. So there's lots of strategies that go into this whole decision, and it's a very competitive environment for food service operators today in the fiscally challenging environment that we're in.
I bet. Thank you very much, David.
Hey, David, I bet you get a nice response from your maintenance department when you standardize your equipment.
Absolutely. And that's working with the facilities department. I mean, they're the ones that have to replace it, repair it, and so having 3 different brands of dish machines, probably not what we want to do.
Dave, I want to stay with you for a second and talk about contactless. How is Lee Health investing in contactless technology for both the back and front of house? Do you see more and more investment and specification of contactless tech? Do you see that kind of just continuing to grow that particular area?
So, again, I'm relatively new at Lee Health, so that's not an area that we've looked tremendously in. But I will tell you that we've dabbled in looking at how we're going to do this, where we can get, whether it's like Christine said, lockers, or whether it's areas that they can pick up in. I know, I'll give you an example. At my former organization, St. Jude Children's Research Hospital, we had an app where people could order their food from. Wasn't well utilized, but pandemic, all of a sudden it really started to become well utilized. And so that was something that was really important for us. And I think operators are trying to figure that out with however they can fit that into their operations. I've even talked to a couple of operators that have looked at going as far as like an Amazon Go type store, where they basically go in and it's all, very, very contactless payment system. And so I think anything that we can do with this contactless technology is going to help us with this labor issue that we're all experiencing now.
Christine and Ray, do you have a similar kind of take on Amazon Go, Just Walk Out technology impacting on the sector? Does that chime with you guys as well?
Yeah, we're doing a lot more self-serve checkouts, the AI technology for checkouts. So we've got several designs going out right now with that. It's not quite the same Amazon Go with the where it gets you as you come out, but it's still a self-scan system like we're all used to in other areas. The other thing I've been seeing a lot of is almost every large hospital project we're working on now has the use of robotics, AMRs or AGVs. And I think there's going to be a balance there with robotics. As always, it's more mechanical. There's more, need to fix them. But I think if we can, keep people from running room service food to, various parts of the hospital and save that labor of, which adds absolutely no value. It's just a transport. If we can use robotics for collecting soiled tray carts and bring up patient tray carts, keep people on the floor where they can, have more educational and more touch points with the patients. I think, like I said, I think that's really booming right now, and all major systems are looking at how do we use robotics to move product around.
Mm-hmm. Yeah, it's funny, right? Christine, I was having the exact same conversation with my clients, and one of the slight differences in the senior care is that they're actually embracing some of the technology for other uses. And he was saying, not to make Big Brother sound so ominous, but getting the correct systems in place to handle data tracking is actually contributing towards the health and wellness of the community. And they get a better feel for what types of food they're eating, what their preferences are, how to keep their menus and inventory is controlled better. And they're also putting in the, cashless convenience stores in the communities. So it's both healthcare across the board. Everybody wants it. And I think the data systems are really playing a big part of it, especially with the apps where they're able to order.
Great to hear. Thank you, Ray. Rick, do you believe contactless will dominate this sector going forward? Are we going to see its application continue long after the pandemic is gone, or has it got real staying power?
No, I don't think it's going to increase total contactless. I think there'll be less contact. It's funny because on our building we had foot pedals and everybody was using them, at the height of the pandemic. Now nobody uses them. People are getting more used to touching. In fact, we've got a lot of visitors here, and amazingly, people are back to handshaking. So I think what's going to happen, and it's fascinating listening to everyone, and so I think that there's elements of these technologies that are going to come together, and they're going to follow the path toward resilience to infectious disease in different markets based on the conditions of those markets. And so I think what we are seeing now is, 6 technologies that are just converging on themselves that are going to impact in our industry in ways that we can't predict. And so we all know 4G going to 5G. I mean, basically all this equipment is going to be like having a wired-like high-speed connection into the equipment itself. So if the equipment isn't connected, it's not going to be part of the bigger ecosystem. And we talked about data and analyzing the data, turning the patterns of data into profits. That's the big thing. And for people, I mean, I'm big into health. And at the end of the day, I believe you are what you eat. Exercise, health, the Apple Watch, tracking, all these things come together into having a great life. And, if you can make it the next 10 years is a bridge to 10 more years with the technology that's around the horizon. So the IoT enables the connection to the cloud, but then AI, someone mentioned AI, this is coming on, this is probably the biggest thing of all. So, because we're talking about a lot of subjects, right? So all of this matter needs to be somewhere, it's in the cloud, where these intelligent agents get embedded into the equipment and they help the operators make decisions. So robotics coming, yes. I don't see robots inside our traditional kitchens. I've got a warehouse full of dead robots. There's not a service infrastructure. They don't like grease. They don't like water. But what I see is invisible automation. Think Tesla, right? So it's the automation's embedded inside the machine. Our fryers automatically filter. And so then we've got, which we haven't talked too much. I think the pandemic slowed it down. But by the end of this decade, it'll be on 95% of the food chain, and it's blockchain. Mathematical structure for storing the information along the supply chain that's hack-proof. So you know exactly where the food came from, cage-free check-in, it's true. And then I'm working a lot on, we talk about standardization, very big, right? And it should be across the industry. Unfortunately, sometimes the competitiveness between in our industry leads to less standardization, but it will lead to more. Open systems are key. And within our company, for example, we have one, 7-inch UI touchscreen, a 10-inch, and they're the same for all the brands. Because now the service person just needs one control, and you can download the software, you can download the user experience. And I believe that appliances will have a longer life now, instead of cradle to grave, cradle to cradle. So by upgrading the software and the all of the programs that go into these appliances, they will create more value over time. So the question was very narrow about contactless, and the answer is I don't see that becoming the norm. I see less contact, but I see designers really thinking through the human-machine interface, how to reduce it by leveraging these technologies that are converging, 5G, the cloud, IoT, AI, blockchain, of course, and then Walmart already requires that for all their customers. And then at the very end of this, and I just had the benefit of seeing an amazing demonstration of new touchscreen technology that's all three-dimensional. So by adding one more layer now, we probably remember the days of wearing the glasses to go to a 3D movie. Now it's that way on a flat screen. So can you imagine what that brings to training? keep it safe, make it exciting, and make it compelling for the people coming back to work. And young people are used to working with digital devices. So this equipment has to move in that direction. Sorry for the long discussion, but that was quite a insightful question, Michael.
No, it's a brilliant answer, and I'd like to bring Christine in on that. Christine, as a dietitian as well as a designer, Rick did mention in there about we are what we eat and healthy food options. In the middle of all this very exciting, compelling, cutting-edge new technology, how do we make sure that food and healthy food choices, good nutrition remains center stage in the middle of all this as well?
Yeah, I think in the retail environment, when we were, we eat with our eyes and we go around, we look, every single place that I've been to, I go around and look at it first, and then I decide what I'm going to eat at a healthcare facility. As they do more ordering, I do worry that there's a disconnect between, being able to see that food and, usually we're putting the fresh salads and the greens and the colors out there so you can see them right away. If that kind of becomes behind the wall a bit, as we move the kitchens closer to that service, I don't know that people are going to see that as much. I might see a picture on their screen and maybe, because it gets to be three-dimensionally, be able to see a little bit, nicer. But I think we need to be careful that we don't lose that connection with our food. I think everybody now is very interested in where the food comes from, but we want to see it too. We just want to technologically order it.
And smell it and taste it and sample it. It's a sensorial experience.
It is. And I think healthcare, is a great time to be in a dietitian and wellness before you get into the hospital, after you get out of the hospital. Food is medicine, food pharmacies, food trucks that go out to the communities, gardens that Dave had a beautiful garden at St. Jude that they use. So I think there really is an interest in making sure everybody is healthy and taken care of both before and after, so they don't have as many folks coming back to the hospital. So I think as a dietitian, it's a great time. Everybody's interested in health. I mean, before you had to kind of force it on people and nobody's really interested. Now everybody's very interested.
That's where I think healthcare operators really need to be focusing on is that readmission part of it, making sure that people consume their food, and then looking at the social determinants of health. Really, that's where we can help get the food into the community and people that need it. So very interesting perspective that we have going on in healthcare right now, and I agree with Christine. It's a really exciting period for us to be in.
Very positive message there. Thank you, Dave. Final question for you all. I'd like you all to answer this in turn, if possible, please. Can you just tell me what you think is the most game-changing innovation for healthcare food service operators as we move on from the pandemic? What are you most excited to see on the horizon in terms of new technology, new equipment? Ladies first, Christine, can we go with you, please?
Oh, my. I think we've touched on all of them already, and what's the one? I think, as Rick mentioned, I think they're all going to be, together. I would say that the biggest thing, contactless ordering, and I know it's not just because we don't want to have face-to-face contact, but in healthcare, there's only 30 minutes to eat, so it's more a speed of service. They don't have time to come down, and these campuses are getting so big. So I think, finding new ways to get food to folks that can't get to our main cafeterias and areas like micro-marts and these delivery points, that we get food closer by technology to the folks that need to eat quickly.
Great answer. Thanks, Christine. Ray, same question to you, please.
I have a twofold answer to that. One of the things that came to mind earlier was I have like 3 B's in mind: buy fresh, buy local, and buy less. And those 3 things will help you reduce your food costs. But food service technologies, what's exciting that I see coming forward are all the ventless opportunities that we have for food presentation. Food is theater. So if we're out there in a dining room with a ventless griddle cooking to order, we can not only reduce the food costs because we're cooking to order and we're not batch cooking, but we're also creating an environment that is a wellness to continue to live healthy in a community, in a senior care facility, or to return to good health in a healthcare facility. So those are the things that I think are going to continue to have big impacts. The ventless cooking, the ventless opportunities are right in front of people to keep food exciting and keep it entertaining.
Great answer. Thank you, Ray. Same question to you, Dave.
Well, I can tell you maybe the most excited, or I don't know if it's most excited or most in need of, probably a little bit of both. You know, I can tell you that, you know, I'll be going to 2 conferences, for the first in-person conferences for the first time in a while. I'm glad to be going to them in August. And on the top of my list is anything that is labor savings or will maximize our labor utilization, because that is every healthcare operator's biggest issue right now, how we can get through this labor crisis. And it does not look like there's any shortage or any quick end to this. So that's what I'm going to be looking for, and I can guarantee you that it's on the very, very short list of every healthcare operator out there.
Great stuff. Thank you, Dave. And Rick, same question, please.
Yeah, so, you know, I would say number one, multi-purpose food service equipment. The days of special purpose equipment are gone, and we just take it for granted that it's ventless, right? Because you got to be able to move it around. But holistically, that unvented equipment does discharge heat. So that needs to be factored into the HVAC system, the circulating system. So it really becomes a very holistic application. I think the second one is just pervasive delivery and the technology to enable that. Virus-free air, of course, we've talked about, and some contactless operation. And then I think there's going to be a step change in food preservation technology and sanitation beyond what we discussed. So some of those elements are what I think is important. On top of that is the digital transformation. I don't like giving a one-word answer around that because it sounds like a flurry of fluff, but digital transformation impacts everything we've discussed.
Great answer. Thank you, Rick. That's a very positive note to end on. This has been a really timely, pertinent, fascinating discussion with some great live examples of how food service in this sector has adapted to some extraordinary challenges this past year. So Christine, Ray, Dave and Rick, I'd like to thank you for taking the time to join us today. I'd like to thank Welbilt for their continued support. Meanwhile, thank you for watching. Please stay tuned to fcsi.org for future events. Thank you.